Welcome, friends. Hope you're doing well. Thank you for tuning into the Optimal Health Program, and glad to be here today to chat with you and take your calls, 888-420-9272, if you'd like to call us and have a little conversation. Otherwise, of course, we love to hear from you, all of our TikTok, Rumble, Reddit fans, Instagram, Facebook, Spotify. The list is way too long to mention. Always have to throw in a little bit of a wonderful shock that last week on Saturday we had 115,000 viewers on Rumble. So Rumble is exploding, and appropriately so. I think they're a wonderful platform. And Frankie, what is it? Their streaming mechanism now is just all over the world?
Yeah, I mean, it's kind of, once YouTube got a little, we're on YouTube right now, but let's just say YouTube was a little choosy on what was promoted. Rumble really kind of blew up, and it's just insane to see how many people are able to reach us.
Everybody's talking about it. So I don't know if there's 100 million people that are members, but to be able to reach 115,000 people in one show in one Saturday afternoon was spectacular. So, we want to be able to put as much great information up there as possible. We want to try to get in and do more programs on there. So we're super happy that we have that connection. All because of Frankie.
Hey.
Because of Super Frankie, the Wizard of Oz, the real Wizard of Oz.
I'll take a little credit.
Yeah,
just
absolutely.
A little.
Got to give credit where credit's due.
But I certainly didn't go to medical school, so.
Well, sometimes medical knowledge, and depending upon how people use it, how can I put this without sounding bad? There are a lot of people who go to medical school and who do the right thing. But more and more we're seeing there are a lot of people who go to medical school that don't do the right thing. And you could extrapolate that, whichever way you like. I would not be the first person to suggest that there are things that are not as good as they could be within the realm of medicine. So I'll leave it at that. A little cryptic, but, I think in my view is that patients should visit a doctor who explains everything, looks for more things, gets them to eat right, exercise, correct their vitamins, minerals, hormones, use things that are natural and safe and healthy, peptides, bringing your hormones back to where you were when you were making them and doing well. That's what I believe. And I'm the only person that I know from all my doctor friends that has this idea and that has this view and, can put this information out there and stand behind it. And because I've done this for the better part of 37 years. This has always been my focus, to be able to get people as healthy as possible in the most natural means possible. So this is what we talk about. So some pretty cool articles. I'm going to talk about one of them right now. It's pretty weird, but true. It talks about high salt diets may contribute to depression. And when I first saw this, I said, well, that's interesting. What's the mechanism? How does that happen? So unfortunately, the majority of people that consume our Western diet here, and you don't have to have me explain to you that junk food's really bad. It's got too much fat, salt, sugar, blah, blah, blah. People are over-salting their foods. And what typically happens is with the excess salt, and they first did this studies and research on mice. I'm sure the poor mice don't think of putting salt in things that they're eating, but the poor mice were given too much sodium. It increased the production of the cytokine IL interleukin 17A. And apparently that increase in the cytokine 17A contributes to depressive symptoms. So interesting that even one little component of your diet, which we've been talking about for years, that people shouldn't have lots of salt on board, can cause a chemical change. That's sort of the take-home point that I'm trying to make with that study. Keep your sodium down to a very, very small minimum. Don't add extra salt to your foods. You can add some pepper, you can add some cheese, which might taste, quote, a little salty, and it may cover that sensation or taste that you like, but you can't have too much salt, just like you can't have too much sugar. And we've gone through studies and topics on glycation, how sugar damages and every part of your body, your cells, your nerves, your blood vessels. So we've got to be very careful with what we put on board. Another great study talks about atrial fibrillation increases dementia risk. And this, of course, was a large study talking about memory, focus, and concentration changes when your heart starts to twitch and beat irregularly. So the cool thing about this study, because most studies are not massive numbers of people, this study was done over the course of 13 years. Researchers used ICD-10 codes. These are the codes that doctors use to say what your diagnosis is. And laboratory data, drug prescription data in the analyses. And in this study, the patients were at least 45 years old. They looked at 2,458,905 individuals. That's a massive study. That's an amazing database to extract information from. So I like the fact that it's a big, big study. They also looked at individuals who had stroke, ultimately including 2,377,638 participants in the analysis. So those individuals that had AFib and those individuals that had the dementia kind of merged and flopped into the same, viewpoint. So important to think that AFib is not just sort of a slightly irregular heartbeat or palpitation. You may not be getting enough oxygen, vitamins, minerals, and hormones to all your cells if your heart's twitching and not filling and contracting and filling and contracting. Every beat of your heart is pushing this column of blood, hopefully with tons of oxygen, vitamins, minerals, and hormones in it. So you want to be able to have all the best things in your blood, getting rid of all the bad things, get to all of your cells and rejuvenate them, allow them to function at their best. And that's why we also talk about exercise so much. At the very least, I tell people you should be doing exercise every day, 30 to 45 minutes of nonstop activity. Could be an indoor bike, outdoor bike, walking around the block, slow, brisk, fast, keep changing speeds, go down 3 blocks, go to the school, do a lap around the track. Whatever you want to do, you should do it every day for a half hour to 45 minutes. And as people start to do that and your body acclimates, you feel better, stronger. You're really making your immune response strong, decreasing your cardiac and even cancer risk. Another great study in Medical News Today talks about weekend warriors. I think I know more weekend warriors through my patients than everyday exercisers, but this study talks about weekend warriors have a decreased risk of death from heart disease and cancer. They may not be doing the activity every day, as I like them to do, but even some of the activity that they're doing on the weekends does decrease their cardiac and cancer risk. So the recommendation is at least 150 minutes of activity every week, 2 days of strength training, which they walk through here. But those that were doing with cardiovascular disease, 31% lower risk for the weekend warriors and 21% lower risk for overall cancer mortality, 32% for overall mortality for all sorts of things. So pretty cool. So I'm not going to say I stand corrected because I don't like to correct myself.
We got a question from Rumble. Someone's asking, I've always heard salt was bad for blood pressure, but depression, how does that even work? What's the connection between sodium?
So as I mentioned a moment ago, it's affecting an interleukin 17A. So the salt helps to spike that interleukin, and that interleukin correlates with depressive feelings. Now, that's just one part of the picture, but if I were to ask, well, what age is the person that has depression? If they're in their 30s, 40s, and 50s and 60s, we have to talk about hormone decline. For women, thyroid, DHEA, testosterone, estrogen, progesterone, because hormone decline absolutely causes depression, anxiety, and sometimes even panic conditions. For men, it's usually a big drop in testosterone or IGF-1, the active component of growth hormone, thyroid, DHEA as well. So when your hormones drop, all those things start to change. If over time, as you get older, your NAD levels are low, which happens to everybody, correcting NAD will give you that great mood, memory, energy, quick thought process, word retrieval. So when I look at a person who says that they have depression or brain fog, all of these things pop into my head. So we can't just blame it on one thing and therefore expect removing all the salt from the diet or the excess salt to be able to change the depression, because part of it might be from hormone decline. So we have to look at the entire picture. And vitamin deficiency, and we'll talk about that in a minute. As well, and I'll tell you clearly, all the time, we see people who are having too much carbohydrate in the diet. Over many years, they're training their body to make too much insulin, which knocks your sugar down too low, which makes you feel depressed, anxious, irritable, panicky, horrible. So these are all the different things that correlate with changes in your mood. Low vitamins, minerals, hormones, low blood sugar from too much carb intake and then insulin release, excess salt.
So we have another question in the chat regarding keto. They say that they actually add salt for the electrolytes to keep them up. What are your thoughts?
Well, salt is not really an electrolyte. I mean, if you look at theoretically Gatorade having all those electrolytes in it, that's what it's been marketed as. It's got more things than just salt. So you have to be careful with the sodium. Most people have 6,000 to 8,000 milligrams of sodium in their diet when you only need about 900 or 800. So I wouldn't keep pushing that up. I'd rather people look at a blood test to look at their electrolytes, look at all their vitamins, minerals, and hormones, and then correct nutrients and electrolytes accordingly. Some people that are doing specific diets before testing their body may be putting themselves into nutrient deficiency, and I've seen this for 37 years. So, I like the fact that people want to change their diet and want to be healthier and lose weight, et cetera, but in order to get the best results that are going to stay, they're going to change multiple things that are the risk factors, we have to understand the mechanism. We have to look at the blood work, vitamins, minerals, hormones, etc. Look at food allergy, because some people change their diet. They're eating a food, now they're reacting to it, and they've got stomach issues or headaches or a rash because they're eating something that they didn't realize was a problem for them. So in a perfect world, if we learn about your body first with our super-duper blood test, and then you want to do more of a low-carb diet, of course, that's what we recommend with vegetables and good proteins. Some people like to do full-on keto. Some people like to do carnivore, which I think, is a little difficult. I can't imagine eating steak 3 times a day. Some people do eggs or protein powders, then they'll do chicken or lamb and then steak. I mean, for those people that are in the danger zone of, high blood pressure, high cholesterol, and all the bad things, even if carnivore helps you to get out of that and burn sugar and fat quickly, so you're getting away from being pre-diabetic or diabetic, if you do it for a couple of weeks and we watch you and your vitamin levels are good, then I wouldn't be that, terribly opposed to it if you're getting good results and you're walking away from the danger zone. I just think that's something that's a really radical change in your diet, to some extent can be a risk. There are people who used to do the Atkins diet and have a lot of fat and a lot of protein, and those people ended up with gallbladder problems because all that fat coming on board, you're asking your gallbladder and your liver to put so much bile to break down the fats that sometimes people would have problems with their gallbladder and gallstones.
That was actually just a question. Someone asked, hey, does salt affect the gut microbiome in a way that could also link to depression?
To some extent. I think that once the studies talk about the interleukin and you have a connection there, too much sodium makes you retain water. And to some extent, when people have too much carb, that affects the microbiome because the carb is causing growth of a variety of organisms in your gut, including the yeast and some of the common bugs. So it's a combination of things. It's not a light switch on and off with just salt. So if I were to scrutinize your diet and look at what you're eating and we take the salt out, keep the carbs down, raise up the proteins a little bit more, fine-tune, correct your nutrients, that's where you get your best results for dietary benefits.
All right, we got another one. I eat out a lot, probably more than I should. Is restaurant food salty enough to impact my mental health?
Probably, because, and I'm not just talking about fast food. I mean,
that's an obvious one.
Yeah, it's kind of obvious. That's never really
crap after that.
Into the good conversation. There are some places that are very good, and diners and such, and restaurants. But typically, you might see more salt and fat and sugar in those preparations because they taste better, and that's what people gravitate towards. Some people like Chinese food. I don't really like Chinese food, although I've been to some places which are really high-end, expensive Chinese restaurants in the city, and the food's great. It's just that I just don't do that sort of thing, that much.
It's funny because I do love Chinese food, but a few weeks ago during the program, you were kind of talking about how, you know, you'll eat all this food and then you're kind of still hungry after because there's no nutrients. And then I realized, like, every single time I have Chinese food, I'm hungry 20, 30 minutes later.
That's kind of the running joke about eating Chinese food. And I've heard that from comedians, you know, for many, many years and such. But
so
you could, if you want to make your own, and I think that's a better option, go out and get some organic chicken or whatever meat you like. Get a wok. I used to wok forever when I was, you know, going through medical school internship and residency, because when I was in Brooklyn and then when I was in New Jersey and I lived at this house, a cool little old, it was like a Munster's house, you know? You remember the Munster's house in 1313 Mockingbird Lane? It was a cool old, I guess, sort of a scary Victorian, but there were different people living on the first floor, second floor, and I had the third floor. And, you know, it was small on the third floor. It was probably really an attic and not really meant to be a third floor, but it was cool. And I had this wok, and I would just go buy stuff and just put stuff in the wok and steam it and, you know, just eat as healthy as I could. But you could do that. It's not hard. And you could get cool little wok recipe books, and you can get great food out of it.
And
you know?
I'll even add to the Italians out there, my wife cracked the code. If you need to make a bunch of broccoli rabe, a wok is perfect.
Yeah.
They don't fall out the edge. It's like
Yeah.
some good Italian dishes with the wok.
Yeah, I'm telling you. Wok, you know, you have to have a different pronunciation there, but you could make that into really healthy food on your own. You don't have to be a super chef, like, of course, Sabrina is. You don't have to be the most skilled person, but looking at a couple of those recipes, it's relatively easy to do. Some people put cauliflower rice in it. Some people would put, you know, strips of chicken or different things in, lots of vegetables. So I think it could be very healthy for you, much more healthy than going out to some of the regular restaurants.
The chat is loving the little cheats with the wok.
Yeah,
You're
look, I
welcome.
mean, it works. you know, necessity is the mother of invention. You know, when I, you know, had really nothing much to live on and was doing my residency in New Jersey, and I lived in this little place, I would take some of the hospital food home, you know, because we weren't paid that much. And, you know, you couldn't afford to go out here or there. And there were some beautiful restaurants in New Jersey. It was phenomenal. And some of the restaurants I know very well because I knew people that were associated with them, for lack of a better discussion, you know, that were heavily protected restaurants. Let's put it that way. But the food was exquisite. I remember doctors taking us out for these meals. I'm like, my gosh, look at this. But of course, there's always a couple of big guys by the door. And, you know, it was very earthy, let's say, a la Sopranos. But, you know, the food is terrific. Is it something that individuals like that, you know, either run or own or have to have the best of the best restaurants? That might very well be so.
It might be.
Yeah. But you know you're dining, you know your meal is going to be very safe.
Yes, true. And I will say to that point about the you bringing the hospital meals back, those meals have gotten quite good recently.
Oh, yeah.
I mean,
well, that's the only hospital that I took food home from. And I probably mentioned this before. That hospital, not going to name it, was a beautiful hospital. There wasn't a bad smell in the whole hospital. Every day you saw the guy with that, you know, buffing thing, cleaning the floors and buffing and cleaning, and there was more cleaning crew there than any other hospital or building I've ever seen. But I think the people that ran that hospital, they wanted it to be a beautiful and perfect experience for people. And the food there was terrific. It was like going to an Italian restaurant. So, yeah, I'd go in the morning and would have, you know, eggs for breakfast. And they had great lunch and great dinner. So they didn't mind that we took big doggy bags home.
it's the least they could do.
So I could avoid having a cup of soup for dinner. But yeah, it was a very nice experience. Best hospital experience I've seen, you know, as a young individual working in all sorts of different hospitals. But they ran that thing beautifully. 888-420-9272 if you'd like to call. Certainly can do that. And we love getting your texts and messages. Let's see. Let's talk a little bit about the vitamin pack that we're putting together because this is happening this week.
We got things in the works, people.
So the idea that I had to make things, and I'm always looking as to how to make things easier and better for people for a variety of reasons. People get frustrated when they go out to a vitamin store and they don't know what to get, and they're buying this and that, and someone says this, someone says that, someone says some sort of advertorial thing on Instagram or social media or the TV, and people just run out and buy stuff, and it's completely non-specific. So in all the years I've done this, we've done blood testing for all the vitamins and minerals. We understand your digestive ability, food allergy, all that. And then I put together recommendations for diet, vitamins, and minerals. So now it's come to me, and this goes back a couple of weeks, a month or two. I thought about making it even easier for people so that I could create vitamin packs, a morning pack and an evening pack. And I'll have a recipe sheet, and I could just check off what I want to put in the morning pack and the evening pack. Everything is set and done. I could adjust it according to a person's medical condition, according to their blood test. So it's the perfect way to get the right vitamins for you and your specific condition, individualized custom vitamins. The other part of this, which is the perfect part of the picture, is that after being on the vitamins for a month, we'll check your blood and see if your vitamins are perfect. If we need to add something, great, we can. So initially, looking at your blood work and making the recommendation and then retesting to prove that low vitamin levels are great is a perfect way to prove that you're doing the right thing. And then some people would typically buy 2 months or 3 months of those vitamins. And of course, the company's going to give you a discount for that, probably a 20% discount. So this week, we're going to make all of that happen. And of course, we have thousands of patients we're putting that together for. We'll also be doing something with telemedicine, because I do that for my patients already. We have a couple of mechanisms where a company that sends out, private duty nurses that are going to refer patients that are Medicare patients. So we'll be talking with those patients on the phone. And with a group that we're working with, we're going to be able to get a lab to go to their home to get the blood drawn, review the blood within 5 days to a week, and start making recommendations and discussion. And we'll also create the vitamin protocols for them. Remote patient monitoring is a brilliant idea, and I think this is going to be a huge mechanism for all patients going forward, and certainly for all Medicare patients, because we can send a blood pressure cuff to your home to read your blood pressure. That sends us information every day on your blood pressure. If your blood pressure is going too high or we see trends, we could intervene. And we can contact your primary care doctor, your specialist, cardiologist, whatever, and coordinate that, recheck your blood if we need to do that. Glucometers are also part of that program, a scale to see how your weight's doing. And Medicare covers all of that to allow us to monitor you, to prevent you from going off the rails and having big issues and then getting into a scary circumstance where you'd have to go to the ER and all of that. The other part of the process is going to be a watch that you could get, and you wear that much like the Fitbit things that are all over the place now, and everybody's making a watch and a ring. But this watch will tell your pulse, can do a little bit of an EKG read, will look at oxygen, will look at activity, can look at your sleep patterns. So that's another perfect way to track patients. So the home monitoring mechanism is going to be a gigantic part of healthcare going forward, because you're keeping track of patients and you're preventing bad things from happening. If, God forbid, a person's going to fall, you may get that notification on the watch, so we could address that. If a person's got a bizarre arrhythmia, we'll get notified. We could contact your cardiologist and, get that picture corrected or know where you need to go for that. So it's a terrific way to keep people healthy and safe and strong going forward. And I think a lot of medicine is going to be telehealth, because many things people don't need to absolutely get to the doctor for every question or every issue they have. And if we can monitor your blood pressure with the device and keep you on an even keel and maybe add medication or adjust things accordingly, then you can do a lot of that through the telehealth mechanism, whether we just do it via phone or do video chat, which we're working on as well. There's a company that makes a device they stick into the back of your TV, and through that you could do a telehealth visit with a doctor or the PA. So working on that as well. Pretty cool stuff.
So Couple questions.
Yep.
One is, are these meant to be taken forever, or do you reevaluate every so often?
The vitamins?
Yes.
Yeah, so your body has to tell us what it needs. I don't think you can get great vitamin levels and certainly nowhere near enough vitamin D without taking it. We have people that go back and forth to Florida, get really tan all summer long, and their vitamin D levels never get past 40. I think your best vitamin D levels are somewhere between 80 to 100. That's where you get your best immune benefit, your best bone protection. And there's studies that talk about this all the time. Frequently, and every day when I go over blood work on different patients, we see their vitamin levels are in the teens, 20s. It's just not good enough. Or in the single digits, it's not good enough. You got to get at least into the 60, 70, 80 range. So that's why we want to monitor these things and keep you in a perfect range. Granted, some people are taking 50 pills a day, which you don't need. It's overkill. And to the largest extent, it's not really helping. And if you're not hitting your requirements and in that right range, you're not really getting the result. That's why I want to do blood tests, recommendation, recheck for blood. Perfect. Take a pack for breakfast, done. Take a pack if you want to go out to dinner, take it with you, take it with your food, done. Simple. We'll also be doing a vitamin consult. Relatively soon we'll start that, where people who don't live anywhere nearby can call the office, fill out the paperwork, do a telehealth consult, get your blood done, and then review that and make your recommendation for vitamins. So we're going to open that up to everybody.
So there was another question just asking about the whole technique with having the watch or the band monitoring things, and they just want to know, like, if they're in a different state, not in New York, near you, are these things that are able to happen?
Because patients are Medicare, and this is the mechanism that Medicare is allowing, I believe so.
Okay.
I don't know with the company that is bringing those things to people. As yet, I'm sure they will. They're not going to just do it for New York and just say, forget about the rest of the people. I'm sure they will. I just don't have that information yet.
Got it.
So let's say they have 50 people now, and those people are going to bring these devices to you and call you and check on you, and then I and myself and the PA are going to be calling and checking on you, and the lab's going to do blood work. I don't think they've got 1,000 people to go bring these things across, every state yet.
Got it.
But the entrance into this is happening now. I'm told that between two different people referring the Medicare patients to us, that one has a few thousand, Medicare patients, and the other one is a very, very, very large organization, and they've got many, many, many thousands. So once this starts and is simple and perfected, as I know it will be, because we've done all this before except have those devices come to people's home, I think it'll spread out through the entire country.
Incredible. Crazy.
Yeah.
Come a long way.
Yep. Well, good
the
things
iPad.
keep happening when you try to figure out how to get the best outcome, best results. But that's been in my head for as long as I've been a person, a kid. When I used to rake leaves and I used to do all sorts of stuff around the neighborhood, my parents probably thought I was crazy. I remember, shoveling snow. And, of course, you take a shovel and you go out there and you kill yourself. And how many houses can you do? And I don't know if I was out there for 8 hours. It was pretty crazy. But a friend of mine had a gas snowblower, and I made a deal with him that I'd pay him a certain percentage. I'd pay for the gas, put the gas in, use his snowblower. I did 10 times as many homes, made that much more money, and I paid him. And it was just a better way to do it.
Yeah.
And using a rake to rake lawns is good, but there was a device that we used to push. There was a big broom, and it would just push all the leaves into the back basket and catch it. So that was just a better way to do it. Now the remote patient monitoring is clearly a better way to do it.
Clearly. And I just have a quick funny story that I think you'd appreciate, Doctor.
Yeah.
You mentioned, so basically anyone who's part of this plan, they're going to have a bag that they could take to, if you're going to dinner and you got your vitamins.
Yeah. Yep. Little pack.
So back in the day when I was in college, I would take my multivitamins and I'd have, that the little pocket in the jean.
Yeah.
I'd put my multivitamin there, and then right before my meal, I'd have it,
Yeah.
all good. And I would do that for a long, long time, up until a moment. As Doctor knows, I used to DJ in the city, and I'd go to these clubs, and the guy would come out, they'd have me skip the line, yada, yada, get ready to play my music. But I would still have to go through security. So I got this guy patting me down, and he's got his gloves, and he's like going through my pocket. And what I didn't realize was the daily vitamin I left in the pocket went through the wash. So
Yep.
now it was like a mushy substance.
Yep.
And the security man is looking at this.
What the
is
heck
this?
is that?
What drug are you bringing in here? And I'm telling him, like, that is a multivitamin. It went through the wash. I almost got
Yep.
kicked out.
Yep.
So I'm glad they're in the
to a lot of people.
I'm glad they're in the bags.
And some people put them in their shirt pockets and some pants pockets or jacket pockets, and all of a sudden you get something back from the cleaners, you get it back, from the water. You're like, oh my God, why did I forget to take that out?
Yeah.
That happens. I'm sure everybody has a similar story with that.
Yeah. We got another question. I says, I work out 6 days a week. Do these packs account for high activity levels, recovery, and performance?
Well, yeah. So each person, when we make the recommendation, we take into consideration their height, their weight, their age, their absorptive digestive ability. People that work out a lot need more vitamins because you're using them, you're burning through them. So that would be a slightly different mechanism than the average person who's just doing, regular workouts, doing a half hour of cardio, et cetera, doing some weights. So they're specific to each individual. I don't know if this person's had their blood work done yet, but I wouldn't be surprised with 6 workouts a week if they're heavy duty or hardcore. Some of your vitamins are going to be low. We also might recommend collagen peptides, protein powder. So the vitamin packs are the core of everything you should have every day. And then we could add more CoQ10 or magnesium if we need, because I'm just going to be able to put individual things in the pack. I'm not limited by having people have to buy a big bottle of something. So I can just put them in and set that up. So yeah, we would also add other things depending upon need, like NAD, of course, or Samorlin, which, NAD and Samorlin or IGF-1, it's injectable, but that's going to be part of the discussion as well. So the vitamin pack is there, but then we have the other discussions on the side.
Incredible. And to all the fitness buffs, like, this is almost like, how many times have you walked into GNC and, some intern who's like a child is telling you, you got to get these pills, you got to get those pills, and sell all these things to you. It's like, how about get your blood work done with Dr. Chris and figure out what you actually
learn first and then figure out what to do based on that. And I find myself saying that every day, especially when we have people that, want to take vitamins, of course. But look, people that have joint issues. I have a patient who's going to do stem cell therapy for, I think, kidney decline, and they've got a bad shoulder. And I said, well, what have you done? Well, the ortho injected the lubricant, then he gave me a steroid shot. I said, what did the MRI say? And they said, what MRI? And I said, to me, it's just ultimately obvious to do the MRI first, see what you're dealing with, and then start a recommendation. And if it is the lubricant or the steroid shot, which we don't recommend, but I'd rather see the MRI, know exactly what we're dealing with, and then put the recommendation specifically to that. It's the best way to do it.
Another question from Reddit. Shout out Reddit. I have a hard time sleeping. Can these packs include natural support for sleep? Or
Sure.
are they just focused
we can
on
add
immune?
into a melatonin combination. Some people do well with that, or magnesium is good for sleep. For some people, they might need a capsule of progesterone to help sleep, men and women. So yeah, there are different things that we can create. Although the vitamin component is a little separate from me contacting a compounding pharmacy and getting a prescription for you for the progesterone. Or we may use a combined formula for sleep that has melatonin and valerian, passiflora, different combinations in it. So we have an unlimited ability to make recommendations based upon what you tell me. So every single thing that you tell me that we put into my electronic medical record, and we use AI to have a conversation, then the AI makes this perfect note. Everything that you tell me goes into my recommendations. So some people may need more magnesium to sleep. Other people may need more testosterone or IGF-1, the active component of growth hormone. So IGF-1, when you're a baby, creates your height in 18 to 19 years. And if you're super tall, you had a lot of it, so your bones kept growing faster than other people who are shorter. But then when your bones close, you can't get taller, and then sooner or later you start to decrease your production, like you decrease estrogen, progesterone, DHEA, testosterone in men and women at certain times. Some people, and thyroid. Some people drop down sooner, some people drop down later, but if we walk your body back to where you were 10 or 15 years ago, And now you have the levels you had then, and your sleep is better. Your hair, your skin, your nails are improving, thicker, growing better, stronger, etc. If your mood, if your sexual drive and function is better, your endurance with exercise is better because now you have that combination of hormones that you've always had and nutrients to create that result, then your body thrives. So absolutely.
And I see one question from Rumble just asking, this is about the vitamins. Are they long-term, is the long-term plan actually to help prevent disease, or is it just about better day-to-day feeling?
Well, no, it's all about preventing disease because there are millions of studies about vitamins on great search engines like Google Scholar. And they talk about decreasing cancer risk, cardiovascular risk, organ decline, enhancing immune response. So there's so much research on vitamins, it's staggering. I don't think anybody can download, even just read the abstract on all these studies. There are literally millions. But the overall discussion is, your vitamins are great, and you want them there every day to decrease free radical damage and inflammation, but you also want them there long-term to make your body healthy and strong going forward. Absolutely. The comment about what do vitamins really do, antioxidant vitamins, like vitamin C and many of them, they will bind to free radicals so that free radical can't steal healthy electrons from your tissue, thus oxidizing or damaging your tissue. It's like pulling a brick out of a wall. If you take enough bricks out, the wall's destroyed. And free radical damage is ongoing every millisecond of your life, and probably beyond that. But the point is you want to stop free radical damage. Free radical damage causes cell mutation, cancer, organ diseases, the list goes on and on and on. So you want to be protected every day with these nutrients.
We had another one from Rumble. They said, I get sick every winter without fail. Can these packs be boosted during cold and flu season to strengthen the immune?
Absolutely.
Most.
You can use combinations and raise up your vitamin C. We could add more vitamin C into your pack. And there's a pretty cool story that I tell the majority of my patients that over so many years of doing this, we've had people that initially, probably Medicare age people, 65 and older, might get a cold or a flu. And then they come in for a couple of vitamin IVs. And we have research that vitamin IVs help to kill viruses, including Epstein-Barr. This I'm going to put up on the wall in my exam room so people can read these two articles. And when they did so well with the vitamin IVs, 2 or 3 of them over the course of a couple of weeks, and they say, every November I get this sinus infection or I get this cold and cough that lasts for a month. In doing those IVs once or twice a month throughout the winter, they don't get them anymore. And then, of course, younger populations that have similar issues where they have the colds and the coughs and et cetera, doing the same thing, they get the same result. They don't get those things anymore because you're really making your immune system stronger. You're quadrupling your killer cells by raising up your vitamin C. And based upon research, you're helping to kill virus. So there are people who do that. And if it's November or December where you're having your issue, if you were to come in and get some of those done, it may be that those issues don't happen anymore. And we have more than a few people who say that.
Crazy. All right, what do we got? I'm trying to reduce plastic. Oh, I think this is a troll. I don't think this guy's being serious.
Yeah.
But I'm trying to reduce plastic waste. Do personalized vitamin packs come in eco-friendly packaging, or is that not an option yet? Hey, listen, we're one step at a time here, Chief.
It's funny too, the ban on the plastic straws. Think about that for a second. You're not supposed to use plastic straws. But what do the plastic straws go into? A plastic cup. What do food packages come in when you do takeout? Plastic food packaging.
What?
So you're taking away one component from a plastic straw to a paper straw, but everything else is still plastic. What bag do you put the plastic container with your food in it into a plastic bag? God forbid you take a plastic container with food, whether you take the top off or not, and you microwave that. What are you doing? You're really exposing yourself. So they're changing one part of the picture. It doesn't really make that much sense to me. You want to change it, change all of it.
And correct me if I'm wrong, but straw float, turtle swim.
Right.
That's it. That's all I have to say.
Right. So I fully agree with improving and making the oceans clear and safe. And I went to this is probably 2 years ago, a big meeting in the city. A friend of mine's a publicist who was able to get me into this meeting. It was an international alliance on, trying to clean the oceans, and they were doing some really amazing things. So I agree with that 1,000,000%. I support that 1,000,000%. But it can't just be the straw. It's got to be a lot of those things. And, people really need to, instead of, dumping stuff everywhere, they've got to put it so that those plastic things can be, taken away and taken out of the environment.
They said, LOL, I knew I'd get you. Yeah, I knew you were a troll, all right? I knew you were getting at you were trying to get a rise out of us, all right?
It still allows us to get a good comment in there. So I've had funny questions on my radio show, and I did that forever, 35 years of that. I had a woman who called in and asked me if her dog's growling, should she pet the dog or not? And I'm like, maybe not. And I wasn't I'm not a veterinarian. So she said, you're not? She said she was listening to the show for a long time. I'm like, so where did she get the idea that I was a vet? Another woman called in and said that she was having this bowel movement. It was coming out like little stones. And, part of me said, do I ask her a funny question, or do you live near the beach, or blah, blah, blah. You fall asleep in the sand, which I didn't, of course. And I said, well, we've got to figure out, what your body's doing, because for some reason you're getting an unusual presentation. And, of course, she went on and was asking more of the same question. And, and everybody that listened to my show, all of my patients called in and were laughing like crazy about it and kept reminding me about the little pebbles. But, some people have changes in their normal function, and they've got to be tested to figure out why.
Yeah, I got a few questions on that one, but I'll skip. We got another question in the chat. This is someone who actually works at night, sleeps during the day, a night owl. Says, will a personalized pack help balance my circadian rhythm for my shift?
If you work a lot at night, you're kind of changing that mechanism, and the human body was meant to wake up when it's light out and go to bed when it's dark out. That's what historically has been thought, since the beginning of time. So if you're switching that, it's not as though you're going to be able to make your body do as well, per se, as you would if you had the opposite schedule. But with good vitamins on board, you're stopping free radicals, you're stopping some of the free radical damage, you're decreasing your risk for heart disease and other things that can come. I hope you're getting good 6-8 hours of sleep, because that refreshes your body. So it's hard to say. I mean, I'd rather look at your blood work and see what's going on there. Some people that are not getting that sleep are not getting the hormone production they should. Their neurotransmitters are not where they need to be. So it's better to talk about it once you see what your blood parameters are.
And I know you answered this question, but they may have come in late, so I won't judge them. But they're just asking if you provide a follow-up blood work or symptom check-ins to see how the vitamins are working.
Yeah, absolutely, positively. So every patient I've ever seen, we do a consult. I sit there, take their history, examine them, get the blood work done. And when they're in the office that day, blood work takes 5 days to get back. We come back in, we go over it, and we make recommendations. And with those recommendations, and everything is heavily documented in my computer with the electronic medical record now. Within a month, if you had low vitamin D, and I made the recommendations, whether it's a vitamin D shot or the oral vitamins, whatever combination we use, within a month, we recheck to make sure that all the abnormals on your first blood test are changing and getting better. Just like if you're wanting to lose weight, within a month, I want to see, have you lost weight over the course of a month's worth of recommendations? Is your cholesterol lower? Are you sleeping better? Do your stomach aches, have they gone away since you've avoided the grains and the carbs? So absolutely. It's visit to visit proving that the recommendations are working. So absolutely. A lot of people take vitamins and never get their blood done. So they're taking handfuls of stuff and they just don't know where they are. So that's why the first and the second blood test are critically important for proving that you're in the perfect place.
They say, thank you, you're welcome.
Absolutely welcome. That's what we're here for. A nice little chat, nice little conversation.
All right, what else we got? We don't have TikTok today because TikTok, we're in a bit of a fight. So I'm sorry to the TikTok audience. You can't find us. We're trying. But TikTok, we're gonna have to figure that one out.
Yeah, some of the platforms are a little bit temperamental. Is that it?
Yeah, it seems medical information is a bit of
I don't know. Is there freedom of speech if you want to talk about medical things that go against the grain? Don't know.
Don't know. Not looking great.
888-420-9272. If you'd like to call and ask a question, you could do so. Here's a great article on stem cell therapy to improve the inflammatory cascade for people that have had a heart attack. And we've done a lot of this because when you have a heart attack and either the clot is blocking oxygen, vitamins, minerals, and hormones from getting to your heart muscle, and those muscle cells start to die, even doing injectable clot buster medications to dissolve the clot, which is important and great, you're not repairing those cells that have been damaged. And after the heart attack, whether small or large, the local inflammatory reaction, I'm reading right from the study, creates more damage and what they call remodeling and cardiac dysfunction. So in a way, it's like someone punching you in the shoulder or punching you in your muscle of your leg. There's inflammation there, and all this craziness is going on. Your body's trying to figure out how to get back to normal. But with this, most people have bad clinical outcome because of the infarct remodeling and the cardiac dysfunction, some of the irregularity in rate or rhythm, because nerve tissue could be affected. And this talks about stem cell therapy, mesenchymal stem cell, which is what we do from your bone marrow, shutting down that bad inflammatory cascade and creating a pretty significant healing response. So this is a terrific study. I'm going to put this up on the wall in the exam rooms as well. So now I have the cabinets covered with articles. I'm going to have the back of the door covered with articles so people can take a little snapshot and look at the whole study. But yeah, I like it when people read. Once again, Garden City office, which I didn't mention, 516-794-0404, 1101 Stewart Avenue, Garden City, right near where Meadowbrook crosses Stewart Avenue, 516-794-0404. Website, drcalapai.com. A lot of great videos there, a lot of great information. For those people who want to make an appointment online, we have information there where you could fill out the basic registration forms and such and get them to us. So we're trying to make that as easy as possible.
Just got to follow up on Instagram. I've got a high stress job and I'm always on edge. Can these personalized vitamins help with stress and burnout, or is that more of a lifestyle?
Yeah, no, because the things that create stress would be a decline in some of your hormones. DHEA is a vitamin, but it's adrenal hormone. It's an important stress hormone. So the people that are most stressed out typically have been using up more DHEA than they could make. And if you put the DHEA back on board, people start to feel better and more able to handle the stress response. They might also see that their hair is turning a little bit darker because, for wondrous reasons, DHEA can help to improve your hair. But that's a good part of it. Again, I don't know about everything else going on, what your cortisol levels are, what your IGF-1 or testosterone or thyroid levels or any of your hormones for that matter. But I would want to look at all of that. Just as I mentioned before, anxiety and stress, that override in many cases occurs 5 to 10 times worse in those people that have hormone decline. So we'd be curious to know how old the person is, man or woman, and see what else we can glean from that. Or what the diet's like. Junk food makes you feel junky. Good food makes you feel great. Too much carb makes you feel more anxious, irritable, stressed, and panicky. So there are a lot of things we could look at.
We got someone who's saying, I already have a cabinet full of half-used bottles of vitamins. I'm talking bottles. Will your system help me stop wasting money and only take what's actually working?
Well, yeah. I mean, that's one of the main points. I mean, the most important point is that you're getting everything you need and getting great levels from it. That's the first step, first comment. Second comment is that, yeah, we want you to spend less so that you're not going out buying things that don't work or buying too many capsules or tablets of things. So it takes all of that craziness and brings it down to a very specific recommendation that will prove is a perfect recommendation based on your blood. So yeah, absolutely. Absolutely.
All right. What else we got? Chat. Listen, you guys are a little quiet today. Maybe it's Good Friday. Is that why?
Could be.
As my priest,
big holiday.
My priest says, he goes, he's got a nice Italian accent. He says, Good Friday. It's not so good. It's a bad time, but you need to celebrate.
That's right. You got to make the best out of it. I thought he was going to talk like this. It's not a good time right now. So yeah, I think people are scrambling around trying to figure out what to have for lunch and for dinner because you can't have meat.
Yeah. And I heard something. I don't know about it, but apparently they say, only one meal today. That's new to me. Are they updating the rules here?
I don't know. I go to church and they change the words around for some of the prayers. I'm like, when did this happen? Because, I went when I was a kid, forever, and I've gone many times over the years.
And with your spirit. It's like, when did that get adjusted?
Yeah. So somewhere someone says, oh, no, let's change the words around. And then you're in the middle of the prayer and all of a sudden there's the people around you are saying things that are different than.
I think the reason is if you skip too much church, they like to shame you to know, and you feel like, I've been missing out. They've changed it all up.
Maybe that's it. Maybe that's it. There's a lovely little church I go to not far from where I am. It's a big, beautiful old stone church, St. Dominic's in Oyster Bay, and it's beautiful. And sometimes I'll just go in the afternoon on my way home from work just to sit there. There's nobody there. Say my prayers. It smells good. It's nice and comfortable. And it's almost kind of like you're having a one-on-one audience, but maybe not. But I like going there when it's empty.
You feel a little cleansed.
Yeah, it's comfortable. When I first went to the Vatican many years ago, I've told this story before. Stop me if I did, but there may be people who hadn't heard it. And I was completely blown away about the enormity of it and how gorgeous everything was on the outside and the columns and on the inside. And it wasn't a windy day. And when I walked through the front door, I felt this wind, like some just massive amount of wind just came from the inside and just hit me. And I was like, I looked around, there was nobody around me. And I'm like, if there was someone behind me, I would have said, hey, did you feel that? Fact.
Never heard that one.
No, yeah. It was pretty wild. So, of course, I spent like 8 hours looking at everything in the Vatican, taking pictures of the Pietà and all the marble and the artwork. It's just staggering to me how there have been people, even going back, all of those years, and back in the 1500s, Michelangelo was doing all of his work, that you could make things look that perfect and that exquisite out of marble and stone. There's just capability that I don't think exists anymore. And maybe it was there for a reason, and maybe it was, divine wisdom and intervention. But you see the Vatican, you see the Statue of David, is just phenomenal. You just can't believe that somebody did that.
Humans, how could humans have done this?
I don't know. And there's a lot of records of how it was done and how many years it took to make these things, but it's incredible that people have that talent.
Insane.
I have a hard time with stick figures.
Yeah, I stick to the computer.
Yep. Good. 888-420-9272. If you'd like to call in to ask a question, you can do that. We touched briefly on NAD, how important that is to your body. It's involved in just about every, biochemical reaction. It takes oxygen, become 36 molecules of ATP. So it's great for memory, focus, concentration, mood, all sorts of different things. So as we talk about with the anti-aging protocol or program, we learn about your body, walk your body back to where you had the best levels of your vitamins, minerals, and hormones, get the exercise kicking up, push yourself on the exercise a bit, and your body just responds beautifully. It's an absolute. It's a fact. I've seen this so many times in 37 years that it's not a question as to what can happen when you do this. It's just when. Some people that don't ever do exercise, it may take you a little bit of time before you get to that stamina level where you say, wow, I feel a huge difference. But either way, my mom, who's listening intently, better be listening, recently we've got her on the exercise bike, and she loves it. And she really didn't do the exercise bike before, but now she'll do a half hour in the morning, sometimes a half hour in the afternoon, At one point, a month or so ago, she did 57 minutes, almost an hour on the exercise bike. She watched an old movie and she loves it and she feels great from it. And she's 95, by the way. So how many 95-year-old people can do an exercise bike for an hour?
Certainly doesn't look nice.
I don't know that many, but yeah, your body will acclimate to it and you'll get great results from it. I just wish it would make her cook a little bit more.
I'm still waiting for her to call in.
Yeah, she might call and I have to be careful. She'll scold me. Another funny thing I tease my mom about is that she has some aches and pains like anybody would, her neck or her back. And I said, many years ago when you got married, you had kids and, you didn't have these aches and pains. She goes, yeah. Like, where am I going with this? And I said, but you were cooking a lot back then. You're not cooking as much as now as you did back then. That might be why you're having the aches and pains. So, of course, she chased me around and she would hit me with a wooden spoon, but...
The logic's there.
Yeah. It's a logical progression. No?
Someone in the chat agrees. Thank you, Sissy Mouse.
Very, very good. What else do we have here that's interesting to talk about? Weekend Wars we talk about.
888-420-9272. If you want to be the only caller of the day, this is your last chance. This is a live show.
We're always live.
Always live.
Except when...
Very rarely.
I have to go away or have something pressing. Here's an interesting article talking about 8 common signs that you're deficient in vitamins and minerals. So this is kind of fluff, but it's good. But it's fluff because it doesn't talk about free radical damage and blocking, free radicals from causing damage. Symptoms of vitamin deficiency include brittle hair and nails, mouth ulcers, hair loss, scaly skin patches, and more. Kind of makes you think like you're going to turn into a lizard. Recognizing these signs can help you adjust your diet, but your diet's not going to get you all the nutrients you need. Brittle hair and nails from some of the B vitamin deficiency. They're talking about using eggs, organ meats, which we don't recommend because there are a lot of bad things in animal organs that you don't want to take into your body. Fish, meat, dairy, nuts, seeds, spinach, broccoli, etc., cauliflower, potatoes, whole grains, bananas, high carb there, so I'm not 100% on with that. But, you want to get your vitamins from supplements along with your food because the foods that are grown in the same soil over and over again are not going to be, totally filled with all the nutrients you want. Mouth ulcers or cracks in the corners of the mouth is usually a B2 riboflavin deficiency, so important to keep your B vitamins on board. Bleeding of the gums, low levels of vitamin C, sometimes iron deficiency, poor night vision, usually vitamin A. And when I see people that have low vitamin A, I ask them, what's your vision like at night? They're like, I can't see anything.
That's what happened when my wife came in. And she actually, it's funny because I used to give her a lot of crap. Because she'd be like, I can't see. She has her glass on. I'm like, can you get new glasses? Because this isn't normal. Well, apparently it was. Thanks, Doc.
Yep. So just got to fine tune it all.
Take it back, Frankie.
So vitamin B2 and B6 can correlate with seborrheic dermatitis. Up to 42% of infants and 50% of adults may experience that. So correcting the vitamins will help. Hair loss, iron deficiency, linoleic acid, niacin, biotin deficiency. So the list goes on and on. So it's a cool little comment. But, magnesium deficiency correlates with asthma, worsening asthma, because the smooth muscle around your airways is going to create spasm. It'll be harder to breathe when your tubes are narrowed. Same thing with magnesium, potassium, and blood pressure. So we can go on and look at many of those things. It's good to be aware of symptoms and say, hey, maybe I should have this checked out. And of course, everybody should do this blood test, looking at vitamins, minerals, hormones. Everybody. Teenagers, vitamin deficiency when you're a teen sets the stage for your brain function. And if you're in school and you're working hard or you're athletic and you're working hard, you've got to get your vitamin levels up higher. So this is what we see consistently. Okay.
Yeah, guys.
No calls today, but we have a lot of good questions.
They're waiting for tomorrow.
Tomorrow will be
show.
big. Tomorrow it's Saturday at 2:30 we'll be here. Until 3:30, 4 o'clock. LFA, big time. Wonder if we're going to break our 115,000 record I'm thinking that's going to happen, even if I have to get up and do a song and a dance or something. You may want to hear me do a song and a dance. Yeah, so it'll be terrific. We're totally thrilled with Rumble and LFA. And we usually get a ton of phone calls. So, yeah, we'll answer every call we get tomorrow. As long as Sabrina's okay with you staying a little bit late.
We'll make it. We'll make it happen.
Awesomeness, people. Thank you so much for listening. God bless you all. Once again, the phone number for the Garden City office, 516-794-0404. And the website, drcalapai.com, drcalapai.com. Take a look. Call us. Thank you for all we didn't get to the emails from people from the website, so we'll do that tomorrow. A lot of them there. So we love hearing from you. Enjoy the day. Have a wonderful weekend. Blessed, blessed Easter for everybody and Holy Week for everybody. Happy Passover. And we'll talk to you tomorrow.